Welcome to the 68th Annual American Healthcare Annual Convention, AHCA NCAL. I'm pleased to interview Pam Duchene, Vice President of Education and Training for Harmony Healthcare International. Welcome, Pam.
Thank you. It's great to be here.
Yep, we're so excited. We're meeting with a lot of people and we're talking about the regulatory and the reimbursement changes. And particularly, I know that you're all over the country, and what are you really focusing on? What's the hot topic?
One of the hot topics clearly is facility assessments and having the process in place that's due, as you know, phase 2 is due by November 28th of this year. The facility assessment should be in place. And it's a comprehensive assessment of the organization, really looking at the services provided, the resources available, their risks for hazards and vulnerability, and then taking that a step farther and looking at competencies and how you are staffed in order to prepare your facility for the next level.
So I know that you're doing assisting multiple providers with this. And how are you guiding them? How are you helping them? And could they do it on their own, or what is it that you add?
Oh, well, certainly an organization could do it on their own, but I think it helps to have some outside eyes, some fresh eyes look at things to make sure that we're not missing the obvious. And sometimes within an organization, they're not aware of the cultural differences that are present within that organization or what they have that's really unique, what creates that niche performance for them.
That niche. And talk to me a little bit about so this facility assessment will be completed, it'll be in a binder, but it's a living
document, right. So you take that facility assessment and then it's like, what next? So from that facility assessment, the leadership team needs to pull together and develop that SWOT analysis. Look at where they're taking the organization to the next level, but in particular, look at what they need in terms of staffing resources, making sure that their staff are competent for their niche products and that they're able to meet the needs of their patient population, as well as look to what next. What should they do next? It's also good to use that facility assessment on an ongoing basis. So to have that as a baseline measurement of where you are right now, and then where do you want the organization to go, and then revisiting that facility assessment so that it's an ongoing process.
And that's fantastic information. And once it is done, and you're going to use it, refining, can you go a little bit deeper on the refinement aspect? I understand the competencies, I understand the staffing, but keep going on that a little bit more, because I think that when reading the regulations, many a provider may have stopped short of, I have to do the tool,
right?
But they don't know that there's actually an end game.
The facility assessment is a snapshot in time. It is not intended to remain a snapshot in time. It's intended to be something that you use on an ongoing basis, so that it provides a plan for the future. It also provides a great opportunity to really look at what you're doing, but then you're going to need to repeat that facility assessment, so build on it, go beyond that. In terms of the competencies too, this really begins to look at the overall adequacy of staffing within the facility, which is not something, it certainly is something that's part of the 5-star program, but looking at the overall adequacy of staffing goes directly hand in hand with competency assessment, making sure that you have sufficient. And it's not just sufficient from the standpoint of administration, but also sufficient staffing resources from the perspective of the staff members, as well as from the patients and the resident population that you serve.
That's fascinating. One last question, and I just to share with the viewers, competencies. We hear what a competency is, but can you describe what is the practical application of a competency?
Yes.
You got it.
I think that there are a lot of organizations out there that are trying to tell you what competencies are. The most important aspect of that is understanding from that organization's perspective what you need in order to be competent. How do you know when a nurse is qualified to be providing care for an orthopedic patient, or for a patient who's at end of life, or someone who's has end-stage renal disease? How do you know when that nurse or that staff member is competent to be able to provide that care? And then that's what you need to focus on. So however you choose to do that within the organization is how you need to be able to document that. And then you have to take it to the next level and making sure that you have that competent staff member providing care.
That's great. Yeah, and,
right.
And just a little bit of last comment on as well, because you created and presented this wonderful PHI HIPAA PowerPoint, and then you have a test at the end of it, because
Right.
and do you think that that's something that we're going to be seeing more of in the next decade or so?
Oh, definitely. It
Okay.
really is all about compliance. I mean, the facility assessment is a really important piece of that, but you're going to take that and you're going to build on that. Your compliance plan, similarly, you need to take that compliance plan and make sure that that's also a living, breathing document within your facility. And then as part of that compliance plan, it includes looking at HIPAA and really making sure that you are protecting that healthcare information.
Right, and the final comment is that with the PHI, the Protected Health Information, you can't expect the employee to abide by the rules if they don't know what PHI is. And
Exactly.
You wrote that eloquent 18-point, there's 18 elements of PHI,
That's right.
including a photograph of the patient. So,
Right.
but yet then
Right.
they take the class, and then they do the PowerPoint, the buildings can use it, but that's a competency. They're showing that they
Exactly.
learned something.
Exactly. That's a great way of illustrating how you test competencies.
Right. Well,
Yeah.
thank you so much for
You're welcome.
talking about the facility assessment. We're happy to see you. Thank you so
Thank you.
much. Thank
Thanks.
you. Great.
Right.